a Q&A opportunity. So if you look down on the bottom right of your screen, you'll see a little box that says ask a question. As we go on tonight, if you have questions, click on that ask a question box and add those questions in there. And I'll go through and moderate the session once he's done his presentation. We've got the chat function rolling. Folks are introducing themselves and sharing where they're from. Please feel free to do that and interact with each other. We've got some staff on there as well. Also want to draw your attention towards the link on the bottom here that says Celebration Days, Auctions, and Raffles. So if you click that link, you'll see a host of different things that we're raffling off and auctioning off. And I'd be remiss not to mention that our session tonight here with Seth is sponsored by Purina. Purina has been a fantastic partner for the Rough Grouse Society and American Woodcock Society and really leaned in the last few years to support conservation work. And so we can't thank them enough. And in addition to one of the things that they've donated as a part of their sponsorship is a 12-bag supply of dog food that we're auctioning off. So I know I feed Purina, obviously Seth does as well. And so if that's something that interests you right now, it's at quite the steal. It's about half priced. So go on there and find that Purina auction and get your bids in and help raise some additional money for conservation. With that, Seth, I'll turn it over to you. I'm going to minimize my video for now until your presentation's over, and then I'll pop back on when your presentation's done, all right?
Okay, that's fine.
All right, take it away.
Will do. Hello, everyone, and thanks for tuning in. I see there's, look, maybe a couple hundred or so. Yeah, looking at the numbers. I appreciate the attendance. It looks like you guys are from all over the place. I kind of thought we would have a heavy representation in the Northeast, but it looks like it's pretty well spread out. I don't see any Westerners up there yet, but Mike is in North Carolina, and I'm in Idaho, but I'm a North Carolina native, and I'm really looking forward to sharing my screen so you don't have to look at the back of my wife's office here. So let's do that. Switch over quickly to this one and kick this presentation off. Okay, so hopefully everyone can see that, and it's taking up your whole screen there, and you can see my two dogs over in Idaho doing some checker hunting, which we do a lot of because it's just highly accessible. But I don't want to talk up Idaho too much, but I want you all to appreciate the fact that it's actually a pretty rock solid rough grouse state as well, including other types of forest grouse. But we do a lot of rough grouse hunting because I enjoy the habitat. It overlaps with some pheasant country in the region that I live in.
Seth, yeah. I'm popping on. It looks like the screen share didn't happen. I just wanted to have you double check that.
Oh, so yeah, okay. Let's go back. It looks like it's. Let's try that again. How about that?
There we go. Excellent. Thank you.
So this was the picture I was referencing and what I was talking about as you all were looking at me. Okay, are we good there? Everybody's maximized in full screen?
Yep, you're good to go.
All right, thanks, Mike. So I was just talking about how you can hunt rough grouse in Idaho, and we do that quite a bit because we can avoid snaky country like this until they've gone away for the season. So it's a pretty good place to do a lot of mixed bag hunting. But chuckers are probably my favorite in the sense that I have short hairs and they can really get out there and range a bunch. And then I just like the covey bird aspect. Okay, I mentioned already that I'm in Idaho, but I'm a North Carolina native. Grew up there and lived there for the first 20 or 21 years of my life. And then moved to Montana to become I guess I thought a professional fly fisherman, but that didn't really work out. Got into journalism, moved towards Western Washington, where I later in life applied to veterinary school, and then liked the area so much around Washington State where I attended vet school that I just set up camp here and moved over to Idaho that has a much more exciting big game hunting opportunity here, and as well as the bird hunting too. So I like it over in Idaho quite a bit. I did general practice, doing as many, seeing as many bird dog patients as I possibly could down in Lewiston, and then decided to go out on my own and pursue probably my favorite type of medicine within the field, and that's reproductive medicine. So I have my own consultation business called On Point Reproduction that does canine reproduction specialty services there. Okay. As I mentioned, I did other things for a lot of years before going to veterinary school. So I was a journalist, did writing and photography, which I still kind of lean heavily on those and now mix those together with my professional occupation. I do some writing for Meat Eater, some other publications as well. There could be some stuff in your Covers magazine, maybe in the wintertime, that you'll see with my bio on there. And I have a couple short hairs. Like I mentioned, a short hair guy. I've got River, the old man there, who's knocking on the door of 12, and then Shine, who will be 5 next week. So, and then I'm pretty active on social media. That's probably the best place to get a hold of me if you have questions or want to see photography from my upland hunting. I don't do as much photography from the medicine side. It tends to be hard to get permission from clients, and I like to respect their privacy by posting those kind of things. But every once in a while, there's something will leak through, and you can check me out there at Bird Dog Vet if you're interested. Okay, so the topics, first aid, health, and nutrition are super broad and would be worthy of a hour-long presentation, any one of them by themselves. So I really kind of wanted to give you probably the top 3, or at least the one question that I get the most in each of those categories. So we're getting like the 30,000 foot view today. We're not going to get too deep in any one of these topics. And then, if something you want to expand on something in the question and answer session, feel free to do that. If you want to send me a message later on, I can try to help you out if you've got something burning. If it's a question that where a medical question that I'm probably going to ask you, like I always do, have you consulted with your veterinarian about it first? I think that's a really great place to start. And I tend not to want to interfere with that. I also don't want you to, I don't want to provide medical advice without actually seeing your dog too. So here we're going to keep it real casual, keep it kind of surface level, and then we can dive deeper if we need to later. So I get this question a lot, and I think there's the expectation that because I'm a veterinarian, I carry this really massive veterinary kit with me in the field when I go hunting chuckers or whatever. And that really isn't the case. And I probably have gotten so lax about it that I'm due for a real disaster where I'm going to wish I had more stuff with me. But I think when people ask me, what do I carry, I kind of turn the question back on them and ask them 2 main things. Like, what are you comfortable carrying in terms of how much weight do you want to, add to your load? And if you're chucker hunting and carrying nearly a gallon of water and food and clothing and stuff like that, do you really want to add another, 2 or 3 pounds of gear and bulky stuff to carry with you while you're out there? If that gives you peace of mind, then it's probably worth it. If not, then it may be excess weight. And then the other question is, what are you really comfortable using? Like, there's no need in carrying a bunch of medical supplies that you don't even recognize what they are. And there's probably some of those that I probably wouldn't recognize right away as well. And if you don't know how to use them or use them safely, then there's really no point in you carrying it around. So those are things that you probably should use as your own criteria for what to bring. My own kit, as I mentioned, is pretty lax. I think it's adequate for what I'm trying to do. But the bare essentials that I bring with me are basically like something to wrap up a leg wound. Notice I didn't say stapler. It's just something to cover it up. And like some tape and some gauze or something that's like a multi-wrap, vet wrap. And then I also carry that multi-tool that you see there in my hand when I used it to do things like pull out porcupine quills from my dog's face. This was actually one and only real encounter. And I think he just went down to give it a sniff to see what it was. He's treed 100 of them. And he, for whatever reason, he turns into like a real German dog when he's got one tree. He just bays like crazy. But on the ground, he had this one cornered and just went to go get a big sniff and came out. And that expression, which I captured with my phone, really, really summarizes his reaction throughout the whole process. He was a real drama queen about it. Okay, my goal and with the wrap and the Leatherman tool is really to just head off a major catastrophe and then set myself up to get the dog out of the field safely and quickly. Okay, that picture there of Bella, who is the littermate to the male you saw in the last frame, she's no longer with us. She was prone to leg injuries, and we would just always carry wrap. And so just to get it covered up, because we just climbed this mountain, and she didn't care. She's perfectly willing to hunt with an open wound. We just didn't want it to get too contaminated while we went on there. You can see, I don't know if you can see my cursor there, but here are the legs wrapped up. That's the spot she always sliced it open. And then she's got some wounds here that was like as she passed through the barbed wire, and then this was the secondary barbed wire interaction. But we just wrapped it up and kept hunting, and she was perfectly good with that, and knowing that we may have to deal with it later. But we didn't try to carry a bunch of suture or anything in the field with us at that time. I think that your goal should always be to protect yourself first, and that sounds a little bit maybe egocentric, but I also feel like you should, well, in addition to that, you should know your dog, and you should know the likelihood of getting yourself bit. I can't tell you how many times I have had a dog come in on emergency with a laceration or a wound or porcupine quills or something that caused it to be painful, but the owner comes in with probably a worse wound from their dog biting them, with them trying to help to begin with before they sought my help. So whatever you do and whatever you feel comfortable doing, make sure you know your dog well, and you don't get yourself into a potentially dangerous situation for you. Okay, so I do keep a lot more stuff back in my truck in a kit, or really it's the same kit I keep at home, and I just load it up and put it in the truck. I don't carry it into the field with me, and I don't really bring a ton of stuff. This is me in the clinic, doing this sedated laceration repair for a lab that was hunting pheasants. It's pretty easy to, well, it's not easy to suture. You definitely learn the technique, and as soon as you learn the idea of sort of like the sterile approach to cleaning wounds and prepping them, I mean, if a dog is laying there not moving and sedated, it's actually not that difficult to fix them. It's when you're trying to do it with them swirling around in the field, which is why I avoid that altogether. But I keep things like sterile scrub, lidocaine jelly to like pour into a wound to kind of numb it up if I don't have the means or the desire to sedate them fully. I'll keep some expired suture around, just that that no one was going to use in the clinic, and supplies like that, like needle drivers like I have in my hand there. Sedation, I mean, that's not something you're going to be able to keep with you. I keep it on hand if I've got a dog that I'm with, like another person's dog that gets into a serious porcupine encounter. I'll have some drugs on hand to rapidly sedate them intravenously and then reverse that sedation quickly, so you're not giving something oral that takes for one, it's hard to give something oral to a dog with its mouth full of quills, and then secondary, those things are really slow to reverse, and that may not be something we want to do while we're out hunting somewhere too. And you can't really put a price on a good squeeze bottle of just some sterile saline, clean out eyes with cheatgrass or grass-ons, or injuries and ears. You probably have all experienced that. And then the wounds too, just to irrigate them out before you wrap them up. I have no problem doing this. I haven't really encountered too many vets that, if you just explain your situation, have a real problem, prescribing these medications, assuming that you come in and get an exam, or have had an exam on record, that vaccines are up to date and things like that. I kind of lean on these 4 prescription medications to keep on hand. Clavamox being one for, you can read as well as I can here. It's just for wounds that are, under the skin, so that, those anaerobic bacteria are covered well by this one. Bite wounds are like from other dogs are good, or even like spider bites, and in some instances snake bites. It's a really good one for that. And then metronidazole is like kind of like go-to antibiotic for diarrhea, stress diarrhea. A lot of dogs get loose if they're on the road for a lot of days. They're eating all kinds of stuff they encounter. They're excited, they're out of the normal routine, and even though they're having fun, they can kind of get loose in the stool. And then Rimadyl, which is a non-steroidal anti-inflammatory. It's like most of you, I'm sure, are familiar with it, but it's carprofen is the generic name. A really great sort of anti-inflammatory that you can keep on hand. You can get it in a chewable form, so it's easy to give if a dog is sore. A couple of these little over-the-counter things that I keep around. I'm a big fan of Benadryl. I feel like it has multiple purposes. It's always not necessary in a case of a rattlesnake bite, which we encounter pretty frequently out in the West, especially in chukar habitat. Not as big of a deal for most of you in the Northeast there, obviously, or Midwest. But it's a good drug to have for spider bites or bee stings, where you get that kind of like rapid inflammation that may be sort of that's those hypersensitivity type reactions. It can help get that under control before things get too bad, and buy you some time to get to a vet clinic in a serious case, or just clear it up altogether in a mild case. I threw the dose in there for you. It's pretty easy to remember that dose. 1 milligram per pound. Most Benadryl comes in 25 milligram human formulations. So a 50-pound dog is going to get a couple of those tablets. I would say that most people that report to me that they gave this, they don't ever give enough. They want to do like children's Benadryl, and they end up giving a small dose of that because there's this fear of overdoing it, and I appreciate that. But for the most part, I think that people underdose this. So don't be afraid to give a stout dose of this. I think the worst you're going to see is them get pretty sedate, which in whatever circumstances may be a good thing. This is something I added to my kit. Kind of did a trial of this Chronoquin, which is a cannabidiol, a non-psychoactive component of the cannabis plant. Most of you, I think, are probably familiar with CBD and sort of the benefits of that. By now, you may take it for your own, medical conditions. I feel like it does a really good job to kind of like, to be honest with you, chilling my dogs out. The first day on a multi-day road trip, we travel, we often don't get to hunt. And when we get to where we're going to set up camp for the night before we start, they are really fit to be tied. And even if they get a little run into them, they're really anxious in the crate. They know what we're doing. They know this is out of their routine, and they're really excited to get on in the field. And this just kind of helps chill them out too. It also does a really good job, like the carprofen, of just like helping with inflammation, which is what a lot of people use it for. And then some dogs actually get this paradoxical loss of appetite when they're working hard, which doesn't make any sense. The appetite would be stimulated. This sort of helps like provide some munchies, and then they kind of want to eat. They do eat better when they're on the road. Okay, that was a lot of information there. So I'm going to question 2. Write those things down and we can kind of address them at the end, but I want to leave plenty of time for questions. So should I spay or neuter my bird dog? And if so, when? I get this one all the time. And I'll just go ahead and tell you that there is no one right answer, that you're going to have to decide basically for yourself based on some of the things that I mentioned and in conjunction with your veterinarian, what makes the most sense for your situation. Okay, but I want to say that I think you're all aware that most veterinarians in the field advocate for early spay and neuter. That has been the protocol for generations now, and it comes from a good place. If you look at the worldwide view of dogs, not among bird dog people, but just among the entire world, there are still places on this planet where dogs are promoting serious human life-threatening diseases, rabies being one of them too. So the idea that we need to control unwanted pet populations is something that is, in terms of public health, actually something that we should applaud. But I don't think that necessarily applies to all situations with people who are owning bird dogs. Just want to give you a background of where that mentality comes from. It doesn't come from a desire for us to, and I joke with my colleagues about this because obviously I engage in a lot of canine reproduction cases. So I joke with the ones who are anti-breeding. I was like, well, if we spayed and neutered everything, we'd all be out of a job pretty quickly. And they really don't have a snappy comeback for that one that at least an adequate one that I've heard yet. So you probably all know that in North America, it seems, in a lot of developing countries, we seem to have a laissez-faire approach to controlling pregnancy in dogs. And then, as many of you are also probably familiar, in European countries, it seems to be the exact opposite. There's sort of this cultural expectation that you'll handle it there. You'll keep dogs from getting pregnant. It's just sort of the responsibility of pet ownership. Diving deeper into what the veterinary, kind of the traditional veterinary approach has been, for females, they want most males neutered around 6 months. For females, they want it done around 6 months or prior to the first heat cycle. The idea behind that is that there's far less risk of developing mammary tumors down the road. And I think that research is actually a little bit murky, but it's still widely touted as the primary reason for doing that. I think pregnancy prevention, honestly, is the primary reason for doing it. It's pretty hard to get pregnant if you don't have a reproductive tract prior to you becoming fertile. So that doesn't require a veterinary degree to figure that part out. I think for a lot of males, it also kind of like nips them in the bud, literally. I mean, a lot of the behaviors, that kind of swagger and the marking, don't really get established because those are primarily testosterone driven. And once that sort of behavior is ingrained as they get older, even if you castrate them, they still more or less do it. And then, for a lot of pet situations, lap dogs, people that don't, keep their eye on their pets like conscientious bird dog breeders do, this is totally fine. I mean, it just works out. It works out well, and I think it's done a good job of keeping unwanted pets in the population. But I think no matter kind of what you choose, any option that you select on, there's going to be risks and benefits. I mentioned some of the benefits of doing it, what the traditional model has said are benefits to doing it prior to puberty. I think there are some risks to that approach as well as some benefits maybe to waiting later or not doing it at all in some situations. Some of these things are well established in the research, have been known for years, and then there's new things that are emerging all the time with additional research looking at the role of the reproductive hormones in the endocrine system and the benefit those may have on the dog's lifelong health outside of its reproductive potential. I've referenced this, and I'll reiterate it. My job is not to tell you what to do. My job is to kind of present you with an outline of pros and cons the best I can, and then sort of help you decide a custom approach to what works best for your situation. Some clients have been through things like pyometras, late in life uterine infections that are potentially life-threatening, and they want to avoid that at all costs because it was a horrible experience for them and their pet. That may be a situation that you want to get that dog spayed at some point in its life, potentially maybe early on. Some dogs have females that went on to become urinary incontinent when they were in their middle age, and that was a product most likely of being spayed prior to that first heat cycle. And those are things they want to try to avoid going forward. So it depends on those type of things. Looking at reproductive hormones, like I said, I do a lot of canine reproduction, so I'm pretty intimately familiar with how these function, but they do a lot more than just control the reproductive cycle. Okay, they're regulating metabolism. There's a huge component in having those sex organs essentially to help the body regulate all of its functions, and then regulate growth as well. It's that sort of the emergence and reaching puberty that tells the body to sort of slow down its growth and reach that kind of physical maturity there too. There's other things like intracellular communication, which I'm not going to dive too deep into, and behavior that are also regulated by those hormones as well. But I want to emphasize that, obesity is a huge problem on my patients. Probably 60% or more of the pets that I see across all breeds, I'll say dogs and cats, but it's probably about the same for both. 60 to 70% are obese. I would say probably more like 40% are probably pushing morbidly obese. And I think there's a huge disconnect with pet owners who think on average that 20% of those same pets are of that obesity status. So they're looking at maybe 2 in 10, whereas I'm seeing and telling you there's 6 to 7 in 10 that are overweight. So sex hormones play a role in keeping the metabolism elevated, and actually serve as a way to essentially prevent obesity. I'm not going to say that I don't have some intact animals that are overweight. I certainly do, but I feel like when I look at a dog and it comes in and it's in healthy body condition, and I know the owner's not really trying hard to keep it that way, I instantly learn that they probably still have their reproductive tract or their testicles. As I've referenced this earlier, but puberty is signaled by the maturation of those organs, and then it tells the long bones basically to quit their growth. They also sort of give those sort of sexual characteristics, what makes the male on the right look like a male at instant glance, and then the female on the left just kind of have that classic female appearance too. When you see dogs that are, especially males, I think when they get neutered prior to that first, not first heat cycle, but when they get neutered like prior to 6 months or prior to a year or to the whatever stage that the long bones start to slow down in that particular breed, they get that real leggy kind of giraffe-y appearance to them. With that change, I think comes a lot, and I think we're still trying to understand how this happens, but there is an association, looking in retrospective studies of dogs that were essentially, castrated early in life, and then an increased risk of them having a cruciate ligament rupture. Association doesn't always mean causality, but I do think that in a lot of these studies, it's pretty compelling evidence to suggest outside of their weight and body condition, the process of having been castrated early in life has shown to be associated with perhaps some poor development of the ligaments there, especially the ACL, CCL in a dog. That can be a potentially career-ending kind of injury. For a lot of people, it's cost prohibitive to repair. I know if you're probably logged into this, you're probably not one of those people that would, you wouldn't want to spend thousands of dollars to repair it, but you wouldn't bat an eye in doing it if you put your dog back in the field for a few more years. Some of them never really do well with the surgery, so it's one of those things that would be awesome to just avoid it altogether. I feel like the incidence of seeing intact animals have this type of injury out just through the normal activity of a bird dog, not through something traumatic like falling out of the pickup or something like that, is pretty rare. I put this breed here. This is Bella. She's did not enjoy duck hunting that day. She let my short hair do all of retrieving. She was fine just looking pretty and staying there in the blind. I put her in there because golden retrievers are some kind of poster breed for certain types of cancers. They're America's favorite, little wonderful house pet, but they do have some pretty nasty types of tumors they get later in life. There is an idea that basically manipulating the reproductive hormones, either taking them away early or taking them away late in life, potentially could actually help the growth of certain tumors. Lymphoma being one, and hemangiosarcoma being another type. And golden retrievers are really prone to both of those types of tumors. And I'm not going to get too deep into that because we don't really have time to go farther than that. But I want to let you know that those, in the absence of those hormones, there are certain other hormones that are then elevated because this all works in a feedback system. And with those elevated hormones might actually prime some of those tumors for growth later in life. This is another poster breed for you Vizsla lovers out there. There's some behaviors that are regulated by testosterone. Some of them we know about already, some we don't like. We've decided as a culture we don't like marking and roaming and generally don't appreciate fighting over mates. I didn't put aggression in here because I feel like that isn't affected either way by the reproductive hormones, but I think resource fighting definitely, especially over intact females, is going to go down by being neutered. But there's also some desirable characteristics that dogs possess and that can be directly attributed to the role that the reproductive hormones have in the brain, like confidence, mental stability, and then those things that just make a dog who they are, that confident, bullheaded bird dog, that those may be compromised by taking those hormones away or never letting them fully mature in a dog. There's been a study in Vizslas looking at some fear-based behaviors, anxiety, aggression, noise phobias that were increased in dogs that were castrated, sterilized prior to puberty, early in life. The food for thought there. And I can send you a link to that paper. It's pretty compelling. So I mentioned already, there's really no one-size-fits-all approach. Work with your vet, talk over your concerns. If your vet's not listening, then it's probably a good time to seek other veterinary input. As I mentioned, a lot of us, in our profession are opposed to anything that goes outside of that traditional model, and that would be your sort of cue that your veterinarian may not necessarily be advocating for what's best for your particular situation. And then some people really need to do some soul searching about it too. Like if you feel like you're in a situation where you're not able to prevent an unwanted pregnancy, then maybe you should look within yourself and decide that maybe we should do something to that being our number one priority. A lot of times people are in denial about those sort of things too. So happy to help you with those as I can. We can discuss that later in the question section. Okay, and then the other thing I get, because a lot of professional trainers are like, don't do it at all, it'll diminish their hunting drive. I think done prior to full physical maturation, so somewhere in that 2 to 3 year range, if you do it that time or beyond, I feel like that prey drive and the mental stability is pretty well solidified in those dogs. And like I hunt over a spayed female, and no one would ever question her drive, believe me. So I feel like that's sort of a non-factor. Look at reference in that Vizsla study. Perhaps if you did it early on, those dogs may not have the mental fortitude to go through sort of a training protocol, or just not be as excited about have that kind of mental stamina for bird hunting. But the first part here, the first point, everybody wants me to say, I know it depends, but can you just tell me when? I'd say, like, if you're willing to wait 24 months, I feel like for most conscientious bird dog people, if you insist on having them spayed and neutered, that's a pretty good time frame to shoot for. But again, your situation is probably going to differ a little bit. Okay, moving on. I'll try to breeze through this last part here so we have lots of time for question and answer, and for you to get in on the auction a little bit too. So what should I feed my dog? I get this one all the time. People ask what I feed, how much I feed, how often do I feed, and what do I do for supplements? And I'll try to address as many of those superficially as I can. So I think it's worth pointing out that dogs they're different than people. They're very complex metabolic machines. Anyone that's watched bird dogs work know that they are fast, and they can be fast for hours on end. That is the way that their canine ancestors hunted. That's the way wolves hunt. They just basically wear out the herd and then feed on the weak ones. They're not those kind of ambush predators like cats. They can certainly move fast when they need to, but they can do that kind of speed for long periods of time. And that physiology is really unique among them, and you kind of feed them differently for that. And they're sort of built to do things differently than people are in that regard. I know this is sponsored by Purina, and Purina makes a great performance dog food. There are other companies that do as well. I feel like people that are having working dogs, bird dogs that are out in the field, should have their dog on a high fat, high protein, premium performance dog food. I really don't get excited about raw diets. I'm fine with some supplementation of raw foods. I don't feel like there's really any compelling evidence that anyone can point to that it exceeds the solid research that most of the major commercial performance companies have done for their food. Okay, the idea behind these foods is that everything that's in them is designed for some function, and really all those together are really getting the body ready to optimize its ability to perform. Okay, a lot of these foods use like this 30-20 protocol, and that's, you probably already know, but that's just sort of like a ratio of fat, or the fat and protein percentages, or protein and fat percentages respectively in those diets. So I feel like from what I've seen of foods, that's a really good sweet spot. I feel like when you exceed that threshold, and there are foods that do, they're not ones that undergo a lot of food trial testing like the major companies like Purina undertake. Those tend to be excessive. I feel like I've seen patients come in for just routine blood work prior to some kind of surgical procedure on, like I said, like a 34% or 36% protein, 26% fat food, and their triglycerides are elevated. And their basically blood ammonia levels from all that protein are higher than they should normally be, and that's just excess work for the kidneys to try to flush that through. And that wasn't something that the dog was ill. We just happened to draw the blood and look at it, and I can probably attribute that to the extra protein in the food that's not being used metabolically. You want a food, if you're going to spend all this money on high quality ingredients, that is actually utilized in the dog, and that's something that a lot of these other foods that throw like this Thanksgiving dinner type ingredients list of dogs, they don't really test for. It's like, okay, this particular meat-based protein is here, but did we actually do the research to show that the dogs absorb this protein and utilize it for their metabolic function? There's a big difference between having a dog eat it and it go into their body and power them, and having a dog eat it and essentially pass right through without being fully utilized. That's just wasted money, literally and figuratively. So, and also you want a food that you can I travel a lot with my dogs. I want one that I can throw in the truck, and it's going to be hot, and it's going to get cold, it's going to get dusty, and it's just going to be stable. And I'm not have to worry about it going bad, like I would say if I had like some really obscure ingredient or something that was really fragile and had to be kept refrigerated or frozen while I was driving. So I like foods that are shelf stable for that. But the idea behind fats, and I kind of did this in reverse order, the dogs really utilize fat as their primary energy source, and they really pre-program the body for work. It's kind of like when the body senses the presence of fat, it sort of gears the metabolism towards preparation for doing that. And that's in contrast to a lot of how carbohydrates work in people. There's really no need to do things like carbo loading in a dog. Fats are the primary source of that. And they can pull that in fewer, I like to think, in fewer metabolic steps to ready energy than a person can. Fats, they also slow down the GI transit, so the dog actually holds on to the food longer, and it makes them have that kind of sensation of being full for a longer period of time. We don't have a lot of time to go into this body condition chart. This is on the back of the door of every clinic I have, and I just think it's worth pointing out where most of our bird dogs should be, which is in this range, so 4 to 5, and a lot of pets I see are kind of sneaking down in this range down here. Okay. I think I get questions about when to feed. I'll gloss over this really quickly. I think it depends on what your objectives are. I think I'll just tell you what I do in my home when we're not working. It's just during the week, and I've got clinic duties, or I'm going to do like a weekend hunt for a couple hours like that. It's going to be twice a day and probably equal amounts. That's no big deal. If I'm on the road and I'm burning calories hard every day, like we're doing a week in Montana or something like that, where they're hunting 6 to 8 hours a day, I'm going to really prioritize the hunt, the meal that comes immediately after the hunt. And the research shows that dogs actually take most of the calories and can store most of that energy for the next need best if you feed them right after the exercise. It's like when the engine is still warm is the analogy I kind of used in one of the Meat Eater articles I wrote. Just that they're primed to make the most of that meal and utilize it later. Not so much early or prior to the hunt. I think that's a suboptimal time to do it. I think always do that safely and with what you're comfortable with. If you've got a big breed, big deep-chested, Draught or a Bracco or Spinoni or something like that, that's prone to GI torsion, then just be smart about how much food you shove in their stomach early on. You get a lot of questions about table scraps. In fact, I just did a piece on it for Meat Eater that came out just a couple weeks ago. I do it. I just say just do it in moderation and do it sparingly. I mean, here's proof that I give my dogs the core of my apple, arsenic and all inside the seeds. So I'm not too concerned about that. You want to avoid, especially when you're on the road and even at home, dehydration or any complications of diarrhea. Even if cleaning it up is a complication, which is pretty annoying when you're on the road and at home as well. In severe cases, and I see this mostly in smaller dogs, but it certainly can happen in big dogs that get access to a lot of real fatty foods, pancreatitis. That will definitely end your hunt, and it could even kill your dog. And it certainly in either case is going to be highly expensive in a medical emergency. So I'm not a big fan of pouring bacon grease on top of food. I've certainly seen it done, and the dogs were no worse for wear, but I also have seen lots of cases, you can appreciate the bias that I have when they come in and the dogs are on death's door from getting into a lot of fatty foods like that. So just do it, strictly. Don't forget water. I think we'll skip over this part. Some dogs are finicky drinkers when they're on the road. Find a way to, this is not about food, it complements it really well. You want to make sure your dogs are adequately hydrated. And get creative. If you need to drown their food when you're hunting, use a squeeze bottle like this to kind of force it down on a dog that would rather hunt than drink, or find ways to flavor the water to get them to hydrate on their own. I'm not a big fan of supplements. I think there are some on the market that are based in science, and I feel like most people don't push their dogs hard enough for them to be completely utilized. If it makes you feel good to do it, go ahead. Just don't do the traditional things like Gatorade, because dogs are not wired the way to replace electrolytes. So there's others on the market, they don't necessarily use electrolytes in the same way that human electrolyte supplements are designed to do. You don't want to cause any diarrhea in the process trying to rehydrate them. With one exception, and that is this is probably the one big plug for Purina, and I love this product in practice. I love the research behind it. I love how well it works. I do give Proplan on the road. I give it all the time when I can afford it, to be honest with you. It's a great product. It will help, with boost the immune system. It also helps get that GI flora really stable when everything is kind of in flux on the road. For some dogs, it's actually really palatable. So I use it in the hospital for like cats that won't eat. And then like I mentioned, that paradoxical loss of appetite. This is a great product to even just sprinkle inside the water if a dog won't drink, or sprinkle on the food to really entice them to eat, and you know they should be. So it's a mess of short hairs out in Montana this year, doing some prairie grouse hunting. That's that same group. And I think I put these slides in here to kind of emphasize that when dogs are traveling, like I think half the dogs in this trip, just to the excitement of being out there and watching their buddies go out and hunt when they had to wait their turn, most of them broke with loose stool. Everybody went on floor to floor, and everybody got cleared up. A couple quick photographs just to confirm with you that I'm indeed a bird hunter. This is my female shine. I like when she gets her nose all busted up and her ear is scratched. And if short hair people, have them when their the ear is flipped back up on her head, I know she's really getting after it. But I do a lot of cool things with my dogs. We at Idaho, you can hunt fall turkeys with dogs, and we do that quite a bit. It's really fun to watch them kind of like track and point and flush, just like pheasant. And then it's really cool. And then retrieve, which is also fun. And then there's proof. Idaho has rough grouse, but not that many, so don't come out here and try to take my spots. But we do a lot of versatile stuff. This is back in Montana, a big sage grouse we did this year. There we are back in Montana. We're wrapping up here. And that's the last slide. So yeah, this is a couple years ago. The dog on the right is old Bella, and she looks really old there, but she's the same age as this guy, and no longer with us. Yeah, with that, I'm going to open it back up to Mike to kind of moderate some questions. I guess I'll have to unshare my screen here.
Excellent, Seth. Thank you so much. I took a lot of notes just for myself on that. I have a 5-month-old puppy, and I'm going around and around with the debate right now on when to neuter her and what that might look like. So I appreciate it. Again, I want to make sure to highlight for folks, feel free to go down to that Ask a Question section and type in a question. We've only got about 6 minutes, but we'll try to go fast and furious here. I do want to kick us off, Seth, with a question. So you listed all of those meds, the Rimadyl and a couple of the other things. Is that something, if I just call my veterinarian and say, hey, if this is who I am, this is what I do, and I have a really good relationship with my vet, can I tell him, hey, I'm going on this trip, I'd like a supply of that to bring with me? Was that acceptable? I particularly the Rimadyl pinged for me because I've had tramadol, for example, for my dogs, which is a controlled substance. So I didn't know how that might work.
Yeah, it's certainly easier to send out Rimadyl than tramadol. And I think that the answer depends on when was the last time you were in the clinic. If it's been like over a year, by law, I have to see the patient and have an established what they call veterinary patient-client relationship on the books. But yeah, if you did that and I saw you like for your vaccines like 2 months ago, then sure, I would personally have no problem doing that. I think that's going to vary clinic to clinic and vet to vet. Whenever I prescribe Rimadyl for say like some kind of sort like injury for a dog, and I know it's a bird dog, I go ahead and just like send home more than I think they're going to need and say, hang on to these for bird season because it might come in handy. But yeah, the other two things, I feel like they're fairly benign in terms of they're obviously not controlled, and then it's hard to overdose. Some of those things are flavored, so if you put them, if you're not careful about where you store them, and your dog is a counter surfer, they could get into a lot of stuff that could, especially if they ate a whole bottle of Rimadyl, that would be a serious problem. But generally that's kosher as long as you've been in the clinic in a reasonable amount of time.
Gotcha. Excellent. Thank you. I really appreciate that. I'm heading on the road here in a month, so I need to re-up. I actually think I'm out of Rimadyl, so thank you. I do have a question here.
Tramadol, not so much.
Very true. Yeah. I do have a question here from Brittany Booth, who's the editor of our magazine covers. She also wrote a note in the chat that you're going to start having some articles in our covers magazine. So thank you, Seth. That's super exciting. But she has a question about what do you suggest to flavor water if they're a finicky drinker if Gatorade isn't recommended?
Yeah. So I'm not, I think if you're looking at restoring electrolytes with a Gatorade, that's sort of separate than them being a finicky drinker. I utilize the Fortiflora because it's super palatable, and like it's made of like hydrolyzed pork and chicken protein, so that's what the substrate is that holds the live bacteria. That happened. Had a dog that got in Montana on that early grouse trip. They got basically like tied up, had like muscle soreness and super stiff and achy from just overexertion and the heat and lack of water. She was one that you had to really force water into. When we got back that night, she wouldn't drink, but I knew she needed electrolytes, and so we made her eat, which she would do, and then we wanted her to drink too because she was super dehydrated. I put 2 packets of Fortiflora in a bowl of water, and she just smoked the whole bowl. So, and otherwise she wouldn't touch it. It was just that good, that flavorful for her. So that was my strategy there too. You probably don't want to sully your own water bottle with that stuff because it kind of smells like pork and chicken unless you enjoy that sort of thing. It's not going to hurt you, I don't believe. I don't recommend you take a bacteria designed for the canine GI tract, but if you wanted to try it, I'm sure it would probably be okay.
Take your word for it.
Have a separate container for your dogs to do that. Yeah. That's my recommendation, and it's worked well.
Okay, excellent. Thank you. I have another question here. I would imagine that this is medication related. I think you'll know what I'm about to say. So the question is, when traveling, how concerning is temperature on Medicam? I would imagine Medicam is a medication.
Yeah, I think it depends on the formulation. So there's a liquid, which I think is, it would depend on what temperatures you're in. I wouldn't want it to freeze. I wouldn't want it to get in the, above body temperature range. I'm pretty sure it's stable. There's a tablet form as well, so I don't know if that really applies. I don't have the label in front of me, so I'll admit ignorance on that one. And Medicam's not one that I typically use. I do carprofen more often. But yeah, it's usually on the label itself. If you have the liquid, you probably have the box, and I would read that one. But I would imagine it's fairly stable and can handle most things.
Gotcha. Excellent. I think we've got time for one more question, maybe 2. So if somebody wants to fire one more question in there, I'm going to ask one. Just I think it's important for folks to hear. So you showed that visual chart of dog weight and really body type. Could you just describe for folks, if you were to look at a dog, what are you looking for to look at them and say they're in or around their ideal body weight? I think that's something that we don't talk about enough as bird dog folks.
Yeah, I think that's a great question. And really, it's not about look, it's more about feel. And that's important too, because a lot of times hair will be deceptive. And like short hairs, it's pretty obvious. You don't have to, you can use your eyes and your hands. But I like to feel some of the tops of the vertebrae as you get down the spine, but not have them super protruding. When I go along the rib cage, I kind of want to feel the indentations around the ribs, but not have my fingers just sink into them. Kind of akin to running your hand across your knuckle, but your hand not being flexed. If you're like this and going in there, that may be a problem, but like this, not so much. And then look at the kind of the points of the pelvis. I kind of want them to be visible, but not just like bony prominences that look vulnerable and not well padded. Those kind of things too. But I want to see a dog that has that kind of hourglass physique from above, but I want to see a lot of muscle too. Sure. They should have. I'm trying to think of I'm not going to share my screen again. One of those pictures, you kind of get that idea of there being a nice tight tummy, big strong muscles in the shoulders and in the back too. So if you've got a dog that's looking thin but doesn't have much muscle, that is not attractive to me in terms of a health perspective or aesthetic perspective for that matter.
Got it. Excellent. So last question, and then if we could be expedient, unfortunately we have to wrap up and head over to our next session. So the last question I have is, are there any safe additives that you know of for water to aid in dental health of bird dogs? Safe, yes. Effective, probably not. Okay.
I think there's some that are there's no miracle one out there. There's nothing that that will replace just teaching your dog to let you brush his teeth when it's a puppy. I think
Sure.
that's the best thing that you can do. I feel like there's some of the products that are on there do maybe some enzymatic change, may help a little, but if your dog is already covered in calculus, their teeth are, the water is not going to dissolve that off of there or anything like that. So they're probably all safe to use. I just don't think you're going to be really pleased with the outcome, with the efficacy of it. Yeah.
Gotcha. Excellent. Seth, I want to thank you so much for taking the time as a bird dog, not myself. That was very informative. Took a lot away. For folks that were following along, if you didn't take notes, you can certainly come back anytime and rewatch this. And again, can't say thank you enough to Purina as well for sponsoring this particular conversation and the broader celebration days and all the work that they do for conservation. So if y'all want to stick around, I'll end this and click us over to our next session. While you're at it, feel free to take some time, go check out the auctions and the raffle. Somebody did bid on the dog food, but it is still woefully underpriced. So y'all should get after it. And again, thank you, Seth, so much. I hope you have a good night.
Yeah, you bet.